So MARIPOSA-2 was originally presented last year. MARIPOSA-2 was a randomized study after EGFR inhibitors comparing Amivantamab plus chemotherapy versus chemotherapy alone. There was a few cohorts on the study, but the real key cohorts was Amivantamab plus chemo versus chemo alone. And what was shown in MARIPOSA-2 is that at 6 months, there was a 51 versus 30% progression-free survival benefit, and at 12 months, 22 versus 13%. There was improvement in time to treatment discontinuation, as well as time to subsequent therapy. So we wait for continuing analyses there. At ELCC, there's a new analysis being presented, and this is looking at what happens at post-progression. So for these patients, what happens when they're progressing on these arms, and what is the evolution? So the things that were looked at in this study were time to subsequent therapy. So when did they go on to a different therapy? So if you look at this, in the arm of Amivantamab plus chemotherapy, at 6 months, 81 versus 59% of patients on Amivantamab were able to stay on their frontline therapy. So patients were able to stay on their frontline therapy even longer, and that held to through 12 months as well. 51% on Ami chemo versus only 26%. We also looked at then what were the what were the subsequent therapies that the patients got, and they were relatively similar between both arms. Some got chemotherapy, some got TKI, some got IOs, all different therapies were there. So there was not much of a difference in that scenario. We looked a little bit more in detail at PFS after subsequent therapy, so PFS2, and PFS2 was improved at 6 months, 88 versus 83%, but a bigger difference at 12 months, 59% versus 40%. So what is that for progression-free survival after the next therapy? So really looking at not just how do the patients immediately do, but how do they do over a long term? And this usually correlates better with overall survival, and the hazard ratio for PFS2 was 0.6. Also looked at a little bit looking at hematologic adverse events and how those played out. There were more hematologic adverse events in cycle 1 with the combination therapy, but that did decrease over time. And from cycle 2 and onward was relatively similar. So looking at this right now, what was found in this subsequent follow-up to the first presentation of MARIPOSA-2, this one, the lead author, Dr. Ryan Gensler at University of Virginia, that the time to treatment discontinuation was 11 versus 4.5 months. Time to subsequent therapy was improved, and the PFS after first subsequent therapy was 13 versus 11 months. The subsequent therapies were similar in both arms, and there was more adverse events, hematologic in cycle 1, but really limited to cycle 1. And the reason we think this is important is for a couple of reasons. As we look to time to subsequent therapy, that really bodes on how many patients can stay on therapy longer and overall survival. So we believe, based upon this, that Ami chemo represents a new standard of care for patients after Osimertinib progression.